Hi everyone, this is شيماء العنقري طالبة طب في سنة 5 من دفعة 2014. واليوم راح أتكلم لكم عن how to deal with medicine in general وعن 4th year specifically because it's different than preclinical years in so many ways. Okay, so أي أحد مو من جامعة الإمام عبد الرحمن بن فيصل, you need to read about our system في the College of Medicine because it's so different and it's based on integration. So at the end of the year نختبر اختبار واحد يجمع كل المواد in an integrated way. So it's very very different وما في أتوقع أي جامعة في السعودية نفس النظام حق جامعتنا. if you are interested you can go and read about it because I don't want to waste your time talking about هذه الأشياء اللي أكثر من شخص تكلم عنها قبل, and I'm gonna focus على sharing my personal experience بداية in medicine in general, بعدين 4th year specifically. طيب قبل ما أبدأ أحكي عن سنة رابعة in general, I just want to say how grateful I am to have this opportunity to talk to you guys, لأن خاصة الفيميلز حق دفعة 2015 يعني أنتوا تعرفون كيف إن لما جيت في سنة ثانية I talked to you about my experience حق سنة ثانية, ولما رحت سنة ثالثة I talked to you about 3rd year, بس لما جيت سنة رابعة ما تيسر الموضوع and I didn't talk to you about 4th year at all. The fact إن I have this chance to share my experience about 4th year وإيش الأشياء اللي يعني I want to say is really really beautiful, and I'm really grateful for Saad for this. I just want to clarify, if you are here for a pep talk, this is not a pep talk. This is a real talk. I'm going to be completely honest with you. If I tell you that something is great, it is great. If I tell you that something is overwhelming, it is overwhelming. Because I needed someone to be completely honest with me and no one was. طيب ليش we need to have a real talk? ليش sharing my experience could help somehow? طيب being يعني a student in 2014 يعني إني أنا أكون student في أول دفعة في النظام الجديد, فبالتالي ما في أي أحد أكبر مني يقول لي what to do and what not to do, I experience things for the first time. فبالتالي I get disappointed, I expect something بعدين يكون هذا الشيء اللي يجيني so unexpected, فبالتالي I failed. So I was so confused because I was trying my best, بس البست حقي ما يجيب النتيجة اللي أنا أبغاها. So I try another way, then I try another way, and I try another way till I actually find what's the best way. Because لما تسمعون كلام الناس يعني يقولون أشياء كثيرة, في ناس يقولون لا don't يعني take other people's experiences when it comes to studying, لأن كل شخص studies in his ولا her own way. طيب هذا صح, بس في أشياء أنا ممكن أستفيد منها من الآخرين, ممكن أستفيد من الريسورسز حقتهم, ممكن أستفيد من أشياء مثلا كيف إنهم يتذكرون أسماء شيء معين. It's not إن you have to copy their experience أو copy their way, بس you need to take إيش الأشياء اللي ممكن تساعدك, you need to know your weaknesses because everyone has a weakness when it comes to studying. And so if you're not interested in real talks, you can stop listening to my videos. If you let it get into you, it will get into you. This goes for all the negative feelings that may come from colleagues, ولا doctors, ولا you, to yourself, questioning your abilities, questioning who you are, questioning why you're studying medicine. كل هذه الأشياء, if you let it control you, it will control you and it will destroy you. So you need to stop it. So كثير مننا لما يدخلون الطب يكون عندهم certain reasons why they want to study medicine. Along the way, they lose هذه reasons وتصير not that meaningful anymore. So you need to believe that everything happens for a reason, and it's okay to lose the reasons اللي دخلتك الطب, because along the way you're gonna have another reasons, you're gonna have reasons ما توقعتوا إن أنتم ممكن تفكرون فيها, بس هذه reasons ممكن تكون even stronger than the reasons اللي دخلتكم طب in the first place. But I understand that losing هذه reasons اللي دخلتكم الطب for the first time is really really hard, وممكن تحسسكم that there are يعني what's the point of me studying medicine, is it really my place or not, وهذه كلها negative feelings that you need to know how to deal with and get over. Okay, so أحس تفلسفت عليكم بما فيه الكفاية as an introduction or whatever. Now I'm gonna talk about شيء مرة مهم وصدق يعني تعبت في حياتي في الطب. It's between my GPA and my knowledge. هل أنا أدرس exam oriented ولا أدرس for my knowledge؟ لأن لما أنا أدرس for my knowledge يصير الهدف أسمى والدرجات ما هي مرة مهمة، ولما أدرس to my GPA بيصير I focus على الدرجات بشكل مش طبيعي and I get anxious and I get really worried and كل همي يكون about exams and it's not about knowledge. So between هذول الاثنين, which one is really important? Well, the typical answer اللي احنا تربينا عليها is study for your knowledge and not your GPA. And excuse me, but that's bullshit. And I don't know if I can say that word هذا public account, but it is bullshit. You need to focus on both, studying for your knowledge and your GPA. You need to have it all. Why you should have only one? They all say that when you study for your knowledge, you're gonna get the GPA, which is actually a myth. It's not true. Because when you study for knowledge, you can go deep, you can go extreme لدرجة أنكم لما يجي الاختبار نص المنهج ما درستوه. ليه؟ لأن I was focusing على أني أخلص نص المنهج و I study it in a very deep way because I don't care about GPA, which is wrong. Because لما يجي الاختبار وتجي درجاتكم مش كويسة, a lot of opportunities are not going to be given to you because of this. And I know a lot of people will disagree with me on this, and that's why أبغى أبين إن this is my personal opinion based on my experience. لأن أنا جربت هذا الشيء. جربت في سنة ثالثة طب كنت I was focusing on knowledge. I didn't care about my GPA at all. وكنت أدخل للاختبارات وأنا مش مخلصة المنهج because I spend a lot of hours studying certain topics. Like if I don't study this topic in this يعني deep way, I'm gonna kill the patient. Like I was living with this mentality that everyone was telling me. Everyone was telling us in this lecture, if you skip this lecture, maybe in the future a patient will come to you and you're not gonna know the answer because of this. And this يعني عطانا pressure مرة كبير when it comes to studying. فصرنا ما نخلص المنهج وبالتالي ما نجيب درجات عالية. So I want to tell you, if you're living with this mentality, and I'm not saying that studying isn't important, when studying deep isn't important, no. بس لازم تعرفون إنه what you're studying in preclinical, you're gonna study it again in the clinical years. You're gonna study it again لما you prepare للSMLE, للUSMLE. You're gonna يعني تنعاد عليك المعلومة more than once. So don't spend too much time and go extreme when it comes to knowledge or when it comes to GPA. So stay focused. Stay focused. This is the best advice I can give you, is to stay focused during the whole year. Know what you need to do, what you need to learn, what you need to submit, whatever they want from you as a fourth year medical student, and prepare for it. You manage your time. لا تخلون your time manage you. And here comes something that is really important, which is إن ما تخلون your emotions or you not being in the mood, ولا you feeling sad today affects your studying. And that, believe me, is really, really hard. For me, I need to be okay to study. Like if I'm not okay, or I'm sad or whatever, I can't study, and that's يعني really bad. So لما تكونون focused and you try your best to separate your emotions عن الأشياء اللي عن إن ما تصيرون dysfunctional أو not really that productive, this will save so much time and it will help you. If you're like me, start working on that. And remember, it all begins and ends in your mind. What you give power to has power over you. So in fourth year النظام إن الروتيشنز تكون كل أسبوع مع department مختلف. مرة تكونون مع الكارديولوجي، مرة تكونون مع الجي آي، مرة تكونون مع الأنستيزيا. So it's يعني too many doctors every week or حتى ممكن every day. فduring هذا التايم a lot of doctors بيكونون نظامهم يعني يحطونكم كذا in a corner and they ask you a lot of questions and they make you feel like you are nothing and you don't know anything and you're really bad and you are a failure, and they will question you and you will start questioning yourself and it's gonna be very overwhelming. So when you feel overwhelmed because of this, I want you to remember my words here. I want you to capture this because you're gonna need it. Do not question yourself. Do not stop believing in yourself because no one will believe in you as you believe in yourself, and no one will care about you as you care about yourself. You can't judge yourself on something you didn't learn yet, and that is the thing that doctors don't understand. You are a student and you are supposed to learn. You're not supposed to know all the answers. So do not judge yourself based على شيء you didn't learn yet. For example, if you didn't study ECG very well, do not judge yourself because you can't read an ECG paper, because that's not fair to you. That's not fair. Okay, here, don't go extreme in the aim of learning. And I know when you read it this way, you think like, what is she saying? But listen to me here. لما كنا in fourth year, a lot of girls were taking a learning process extreme لدرجة إن جاهم burnout syndrome. So كيف يعني they take it extreme؟ يعني مثلا they come on weekend, they stay in the ER because they want to learn more. During breaks, they go and see patients. They try to examine everyone in the hospital. And I know that practice really help, but when you see everyone around you doing that, you feel overwhelmed, like, should I do that? Should I be here in weekends? Well, guess what? If students can work and learn during the whole week, then why they gave us weekends? Why they gave us vacations? Why they gave us summer vacations? There is a reason why. Because we can't take it. Because we are having a lot of stresses and we need to have a break. So when you have a break and don't go extreme because you feel you want to learn. I mean, you will learn. You have a lot of years to learn, but you need to use هذه breaks to like enjoy your time and go out with your friends and see your family and watch a movie or watch your favorite show and laugh and live your life, because it's not only about studying and learning. There's like a lot of life غير عن هذه الأشياء. And if we're gonna take it from a doctor concept, يعني كيف هذا الشيء راح يفيدك as a doctor in the future? Patients need someone who knows how it feels to be alive, who is hopeful, who is positive, who is funny and make them laugh. Because when you look at يعني the best doctors, they're not like robots. They're not like, they don't have anything to talk about. They're social. They know how to connect with the patient and communicate with them and understand them. And in my personal opinion, I don't feel you're gonna learn that by being in the hospital 24/7. Okay, about rotations. I want you لما تروحون كذا rotation حق أي يعني كل أسبوع يكون your aim إن تكتسب الكلينيكال سكيلز اللي هم يبغونها من ناحية history و examination. تكتسبونها حق دراسة أوسكي، يعني تقعدون مع الدكتور tell me how I examine perfectly, because in 4th year you're not gonna examine normal patients, you're gonna have like cases. راح يجيبوا لكم ناس عندهم murmurs، راح يجيبوا لكم ناس عندهم I don't know ascites whatever, and they will tell you to examine them and tell me the findings. So you need to focus على كيف تاخذون history صح، كيف you present هذا history، كيف تسوون examination, and focus على time, because if they're gonna treat you the way they treated us, they're gonna only give you 5 minutes each station. طيب الحين راح نتكلم عن الريسورسز. ايش الريسورسز اللي تحتاجونها بالفورث year في each subject عشان بإذن الله you master the test and you actually كذا 100% understand each lecture. طيب when it comes to pathology, slides with doctor's explanation تاخذون their notes is more than enough. ونفس الشيء بالنسبة لل evidence based medicine أو occupational medicine, environmental medicine, ethics، هذه الأشياء كلها السلايدز مع doctor's explanation more than enough. Okay, when it comes to surgery, doctor's explanation, slides are more than enough. But I'm gonna show you 2 books if you want, like if you are interested in surgery or you want more knowledge أو تبغون أشياء تساعدكم مراجعة الاختبار or something. Okay, and here surgical recall recommended by most of the students. دايما الدكاترة يحبون يجيبون منه نظامه اللي كذا سؤال وجواب. Okay, now I'm going to talk about internal medicine. في 3 main books. They are really important, and I really recommend you to buy the 3 of them, or at least have a PDF يعني file of each one of them. So first, Kumar, which is clinical medicine. الكتاب is very detailed, so it takes time. فمتى you study from it? In my opinion, you study from it very common diseases in our country. For example, valvular heart disease. That's a thing that you really need to know all the details about. وجت questions في سنة رابعة كانت بس من هذا البوك, which is a favorite reference بالنسبة لدكاترة الميديسن. yeah, I recommend it when it comes to أشياء مرة common عندنا, لأن يجيبون منها أسئلة detailed, I think this is the best book you can study from. Okay, now step up to medicine. Step up to medicine زي ما تشوفون هنا, it's more يعني كأنه summarizes all the important informations in a very beautiful way, ومرة يساعد بأنكم you remember all the details. So I recommend لو كان الشيء مرة common, you study from Kumar, then you read Step Up to Medicine, or as يعني a lot of students do, and they only study Step Up to Medicine, so you can do that as well. Okay, كيف تقررون which book to buy? In my opinion, do you like to understand the information or you just memorize it? If you are more with memorizing things, حتى if it doesn't make sense to you, maybe you only need to Step Up to Medicine. But to me, and I can't, I need to understand the information deeply, in the depth I need to know. I prefer Kumar and Step Up to Medicine. Okay, now Nicholas اللي هو clinical examination. هذا أكثر كتاب بيحبونه دكاترة الميديسن. They love it. يعني يجيبون كل شيء فيه. ممكن لو أنتوا درستوه تحلون 50% إذا مو 60% of the questions تجي في internal medicine. مرة يهمهم everything, في جداول في everything. It's more of clinical presentation, more of لما تجيك حالة how to approach it, كيف تعرفون إيش السبب حقها. It's very useful. يعني حتى بعد 4th year you're gonna study from it في 5th year. Okay, some students like this Oxford handbook for rotations and they read from it, but personally I don't like it because الخط مرة صغير والمعلومات كذا صايرة زحمة. I will show you another book مرة ممتاز للrotations يعني for my opinion. هذا كتاب حق الأوسكيز من نيكولاس. ما هو تلخيص للكتاب الكبير. It's more of OSCE oriented يعني يحدد لكم بالضبط كيف يصير الإكزامينيشن، في إيش الquestions اللي you need to ask بكل complaint based. يقول لك مثلا الانسرز حقت البيشنت، كيف you exclude diagnosis وتطلع diagnosis في النهاية. يعني one of the best books that can help you في الأوسكيز، بس ما هي شاملة 100%. يعني ما ينفع you study from it للأوسكيز and that's it. لا, you take this, you take all your notes during rotations وتسوي لك like material تعتمدها عشان الأوسكيز. آخر شيء من resources هو الراديولوجي. بالنسبة للراديولوجي if you studied the slides alone without a doctor's note you're only gonna يعني answer 20% of the questions of the exam. If you take all the notes the doctor is saying and studied it very well, you're gonna answer up to 80% of the questions. If you searched for the diagnosis وهذه الأشياء والصور and you understood it very well, you're gonna answer up to 95% of the questions. 5% of the questions were يعني we don't know where's the answer and we talked to them more than once. I'm not sure if they changed this بالنسبة لكم this year, but this is how يعني worked for us last year. فيعني focus على radiology because لأن يعاملونا زي الميديسن زي السيرجري من ناحية عدد الأسئلة. فتقعد تدرس سيرجري وميديسن وكل المواد مرة كويس وتطنش الراديولوجي وما تعطيه يعني اهتمام، تروح كثير من درجاتك because to them it's as important as the other subjects. فأعطوه أولوية بالنسبة لكم. Ask doctors, know what they want you to know. Of course بعد ما اختبرتوا أول اختبار you know what type of questions come من الراديولوجي. So بالنسبة للexams in general ask doctors what they want you to know as a fourth year medical student. لا تدرسون على عماكم. Know what you يعني know depth of learning اللي you need to reach as a fourth year medical student عشان you expect the questions you master it. وتذكروا أن كل ميسر لما خلق له. إذا ربي ميسر لك أنك تروح مكان معين راح تروح هذا المكان غصبا عن كل أحد تاني. ما راح توديك ما راح تمنعك أنك تروح عنا شروط الهيئة. فلا تقعد تشيل هم أشياء بكرة وفكر باليوم وشيل هم اليوم، لأن لو تقعد تشيل هم بعدين ما راح تخلص و it's gonna be overwhelming and you will get depressed. So just believe أن كل ميسر لما خلق له ولا تشيل هم بعدين وخلي همك على ربك. Finally, I really hope and I helped somehow وما كنت يعني a waste of your time. If you want to contact me for any questions, you can go to my Ask account and write whatever questions you want. I really like to help others. I enjoy helping, so don't feel like you don't want to ask me. And if you want to give me any feedback about today, whatever, you can go and tell me that as well. I'm gonna wait for you guys and I will answer all your questions as soon as I can.